The quote assigned to me is, "Your life expectancy, how long you live, should not be dependent on the resources you have accessible to you." This was stated by Dr. Tony Eiton, who was the director of the Alameda County Public Health Department, and he couldn't be more accurate. I worked for many years in the Children's Emergency Department at a large Level 1 trauma center. I witnessed firsthand the disparate resources afforded to those in our community. Like so many social justice issues, the questions are often more plentiful than the answers. How do we begin to address social determinants of health? Where in the cycle do we intervene? Another quote from In Sickness and in Wealth impacted me far greater. We carry our history in our bodies. Those words have weighed on me for days. We are essentially accumulation of our past choices, our environment, and past stressors. The foods we choose and the food choices we have access to, the neighborhoods we live in, some of us with green grass and walking paths, others of us with broken glass and boarded windows, the background noise of our daily lives, birds chirping, horns blaring, fighting, or worse, gunshots, all play a part in our overall well-being and wellness. Our behavior and our choices are determined by our access. Our income and our education affect the choices we are afforded without doubt. If 40% of health outcomes are tied to social determinants of health, America cannot afford not to reconsider the access and choices afforded to each of its citizens. America needs to recognize that social determinants of health aren't merely a healthcare issue, but rather a societal issue determined by policies or lack of policies that either support or oppose the allocation of resources for all of America's citizens. America needs to change not simply insurance or access to healthcare, but equal access to education and housing, as well as equal access to homeownership. America needs to consider zoning laws or incentives for access to groceries in impoverished neighborhoods, and can consider further zoning laws to limit the number of fast food restaurants in an area. Taxes and tax laws need to be fair. They need to be reevaluated. Access to safe and reliable public transportation needs to be addressed. Childcare needs to be considered. Economic policy needs to support America's citizens at all income levels. There is much work to be done to reduce healthcare disparities. This is not a poor man's issue or a government problem. We must all be invested in finding a solution. We must all consider ways to empower communities and continue to educate ourselves on public health issues. The fate of our nation depends on it. If there was one health-related problem I could positively influence, it would be to shift the focus of our current medical system from disease treatment to prevention and wellness. The best way to treat a heart attack or an asthma attack is to prevent one from happening in the first place. Providing people with access to healthcare is one step in the right direction. I would love to see an increased focus on patient education and access to resources. I can influence this change in my setting by advocating for staffing ratios that support time for education and coordination of care. On the state level, I can stay invested in legislation that allows advanced practice nurses to practice at the top of their license. I can offer my talents to develop or proofread patient education materials, as well as share public resources with others. Much of our healthcare community operates in silos. Through collaboration and idea sharing, we can build relationships and share resources. I believe we all go farther when we go together.